Hi, everyone. It's Doc Talk. We're at the end of June, beginning of July. July 4th weekend coming up. Love this time of the year. Can't think of anything better than what we get to celebrate, which is our independence and our way of life here in America that we really should appreciate every day. So happy 4th of July to all the Americans. And there's celebrations in other parts of the world going on now, but we get to celebrate the 4th of July. Always a great time of the year to talk about summer safety, and we kind of start with that Memorial Day and then swing into it. So we'll talk a little bit about that for this weekend. The news around the country now in the COVID world is around vaccination programs, around some treatment programs, and they've made some news this week, and about how to plan ahead for the fall, which is really the biggest topic. So let's go through this quickly. Number one, our treatment sequence hasn't changed over the last couple of months. We still have one of the monoclonal antibodies, bebtelovimab, which is an infusion that's given to people who have Omicron and can prevent further serious consequences of Omicron infection, COVID. We have an oral agent, which is Paxlovid. And Paxlovid has been in the news this week because our lead physician in the country, Dr. Fauci, has had the disease, took the Paxlovid treatment, had a couple of negative tests, and then tested positive again. That's called a rebound, at least by lab tests, rebound, so that you have the disease, you take a treatment. There's a couple of days after the treatment where you're symptom-free, and in this case, test negative, and then the disease comes back or the test positive comes back. That's kind of strange. And in other diseases, we would say, well, your course of treatment wasn't long enough or effective enough. Occasionally, people have this happen. They have a skin infection. They have a strep infection in their throat. They have a urinary tract infection. They take a course of antibiotics. Their symptoms go away for a while, and then they pop back, and then they need to be on treatment again. And this has been reported occasionally then with COVID treatment with the oral agent called Paxlovid. So that's been in the headlines. Fortunately, Dr. Fauci has not gotten very sick with his COVID. Many of you sitting out there like me have had COVID now, despite being vaccinated and despite having had an infection before. And the symptoms relatively mild, don't end up hospitalized, don't end up on a ventilator, don't have fatal outcome, don't have long COVID. Those are all very important things on the back end that we make sure we don't have. Those have not been occurring at the back end of a Paxlovid rebound of COVID. And so far, Dr. Fauci hasn't reported that he's gotten very sick. Now, remember, he is 81 years of age, and although he acts significantly younger than that, he has a reason to be very careful, and that's why he took the Paxlovid treatment. And it was noted and reported in the media that his test turned positive again after his Paxlovid treatment and a couple of negative tests. So worthwhile everybody understanding that. Also worthwhile noting that he is not very sick. He's taking great care of himself. He's been vaccinated and boosted twice and still managed to get this very infectious Omicron variant, which seems to break through a lot. Okay, vaccines. Last week we talked, the pediatric version of the vaccine was out. It was starting up the Moderna and Pfizer vaccination programs for the 6-month to 5-year of age patient group. Those programs are up and running strong now, many of them based around pediatric offices and pediatric clinics in the region where you live. If you have questions about it, you can get a hold of the Children's Hospital and they can give you guidance. There's 2 types of immunizations, Pfizer and Moderna. Right now, the Pfizer vaccination series is 3 jabs and the Moderna is 2 with relatively equal effectiveness, but talk to your doctor if you have family members in that age group and are interested in vaccinations. What's really important news in COVID this week is the FDA and the CDC both planning for the fall. What are we going to do this fall with concerns that COVID could rebound and rebound in a way not only where people get sick, but we begin to fill up the hospitals again with COVID patients and potentially new variants that are based on the variants that are going through now, or something new comes from across the globe somewhere out of the COVID world. So the CDC and the FDA are working on strategies. What they believe is that they will be able to tweak the current vaccines to accommodate Omicron and potential future variants, so they can modify the RNA that's part of that vaccine to where they can cover new variants and other things that may be going on this fall. As I've talked for the last couple months, I think it's wise for healthy adults now who've been vaccinated already to wait to get a booster until the fall to see what modifications are being made. And that, for now, is the FDA CDC strategy in general. If there's reasons to get a booster now, because you're around people who are compromised, you've recently been ill with something else and want to protect yourself from COVID, you may very well want to talk to your doctor and get a COVID booster now. But for many people who are healthy, who are not at risk themselves or with at-risk family members, you may want to wait until the fall. So that's really important news. Understand the headlines that now it's about planning for the fall. Our big news, nationwide is we seem to be past the current wave and are on the downside with decreasing numbers of cases, hospitalizations, deaths, and people on ventilators. So that's really good news. All right, another thing in the news this week I want you to understand, and that is the disease monkeypox. Monkeypox. So you've heard of poxes before. All of you that have a little gray hair like I do, you were immunized to smallpox when you were little. I still have a big scar on my left upper arm. I don't remember getting that. It was too early in my life to remember it, but we were vaccinated against smallpox, which is a devastating, horrible illness that killed millions and millions of people over the globe in early years. Until about the early 60s, we were vaccinating for it in this country. And then with a lot of work by great people from the CDC and the World Health Organization, they eradicated smallpox on the planet. For many years, chickenpox has been a virus on the planet. It's in the same pox family. And chickenpox is readily known as the most infectious agent that there is. In the course of having a chickenpox illness, if you're exposed to someone who hasn't had chickenpox and you're in a room together with the infected person, you're nearly 100% likely to pick that up. That is really kind of the gold standard of how infectious a virus can be. We now mostly have children vaccinated to it, so it's another pox that we have a vaccine for. And the reason monkeypox is a concern to the World Health Organization and to this country is any of the pox viruses can be bad. And if you think from chickenpox to smallpox and things in between, they get progressively more deadly. Monkeypox has been brewing in Africa for probably centuries. We've been able to know and identify the disease. It produces big pox lesions. It is spread by air, as all of the pox viruses are. And monkeypox has had relatively small outbreaks contained mostly on the continent of Africa in the past, where now it has moved out of Africa and is in countries across the globe in relatively small outbreaks. So these are single digits of outbreaks in other countries. And they're pretty readily identified by the pox lesions that you develop relatively quickly. And then very quickly, pox can be vaccinated after you have been exposed. All right, so pox, once you have had it and are spreading it to other people, it takes a while before those other people are going to get sick. In that gap time, we can actually vaccinate people. and it's effective in killing the monkeypox before it would break out later. Whoa, is that different than all of our other diseases? But that is the strategy that worked for smallpox before. And that is how our scientists eradicated a horrible version of a pox disease in the 50s, 60s, early 70s across the globe. And so that right now is a potential strategy for monkeypox. It is, we have vaccines, we have several different vaccines for monkeypox. And there is a potential, again, that it could become a more serious illness and more common, and where we have to think about vaccination strategies for people around the ill individuals. It may also be that we have to have vaccination strategies for bigger populations. And what's most important really about the pox is pox viruses live in the animal community. What you don't want to have is pox that gets out, for example, in this country, finds an animal reservoir, so a group of animals that it can live in, breed in, go through generations of animals, somehow get either more contagious, more dangerous, or both, and then break out in later years. So what you don't want to have with the poxes is an animal reservoir that allows that disease to brew, potentially get worse, and affect future generations of human beings. So why we want to control monkeypox now in this country is to prevent humans from getting sick from it now, but also to prevent animals from getting it, developing a reservoir, brewed there for years to come, and then come back and affect later generations. So stay tuned for news. It's not a very infectious agent that we're worried about right now for millions of people or even hundreds of thousands of people in this country. But we don't, like any other disease, we don't want it to get away and get into an uncontrolled state. So with that, let me follow this, this little infectious disease with, this is 4th of July. Great fun, enjoy your time, take a break, etc. There are 4 things for you to be aware of on the 4th of July weekend. Heat, sun, water, moving around. 4 things. Heat is in terms of the heat itself, fire and fireworks, which are all very popular the 4th of July. Professionals should be handling the fireworks. None of this, here hold my glass and watch this kind of deal. That's an invitation to disaster. Fireworks are very dangerous, and there's nothing worse, let me tell you, as an emergency physician, nothing worse than seeing people burned 1,000-degree fireworks. Sprinklers, they're just sparklers. They're just sparklers, okay? They're not just sparklers. They're very hot. They'll burn the kids like crazy. A little firework set to go off, and the can falls over at the last minute and shoots the fireworks into a child or shoots the fireworks into anybody's face is a disaster, and it doesn't have to happen. Don't let that happen to you. So be careful of the heat, be careful of fire, be careful of fireworks. Number 4, be careful of the sun. Your skin is still not acclimated in most places. Make sure you wear your sunblock, but more importantly, limit your time in the sun into smaller blocks as you acclimate. August, September, you can spend a lot more time in the sun. Now is the time of the year to be very careful to not ruin next Tuesday, Wednesday, Thursday, burn and peeling, all right? Number 3 is water. We love the water events. Gets hot. This is our first chance to jump in our favorite body of water. Drowning is still very real. Getting in trouble, drinking and being around water is especially dangerous. Please don't do it, and be respectful about the kids around water. There is no worse way to spend your holiday than grieving over a lost child who got to the pool, got to the creek, got into the, another body of water and drowned. And those are just tragic events you want to prevent. And for the adults, being careful around water instruments, water toys, propellers, etc., and drinking and being around water is particularly dangerous. The final thing is movement, which involves two things. Be careful driving and running your motorcycle, your ATV, and other motorized vehicles. Be careful and don't ever mix that with drinking. Number two, for all of the people who are going to do sports this weekend, don't ruin your hamstrings, your biceps, et cetera, by all of a sudden thinking that a winter's worth of downtime, and this is finally the time we get back together. We play softball, we play football, we play, frisbee golf, and you haven't done that for a while because of COVID. You need a nice warm up, and you need to take it easy on the extremes of the sports. So with that in mind, enjoy the holiday, get some relaxation. Next week, we will be back, and we'll probably talk about the aftermath of the 4th of July weekend, if that's something to look forward to. But enjoy your weekend now. Doc Talk. Happy 4th of July.